So we've got Buchra Ali.
Assalamu alaikum.
Wa alaikum salam wa rahmatullah.
طيب, so my question is in regards to type 1 diabetes.
Yeah.
So my doctor in general, from the very first time I was diagnosed, like around 16 years ago, they told me fasting is not allowed for you. And that was in a Muslim country. But then I heard some scholars, whatever, saying that it's not up to the doctor to make a final decision about fasting or not. You're going to have to speak to a mufti, and then they will analyze your situation and look into it and whatnot. What I was doing throughout all these years is I was used to fast just a few days. And honestly, I wasn't really sure, like, what position am I on? Like, is it halal? Is it haram? Is it obligatory? It's not. As I was the one who asked the first question, like, do I actually have to ask a mufti before every Ramadan? Like, for him and give him my like, for example, my analysis, my blood test, whatever, and let him take the decision himself? Or is it up to the doctors?
Okay. So your question is related to safe fasting, okay? And then also you've also added in another additional question, which is related to how do you make a judgment regarding whether it's obligatory for you to fast or not? So very good questions. And this slide hopefully will answer your question or your questions. So first of all, when you judge your unfitness to fast, there are three things that you make reference to, okay? One is you make an assessment of, if I do fast, will my symptoms be exacerbated? Am I putting myself at risk? So you will know that better than anybody else, because that's your condition and you're the one who's going to experience this. So clearly, if you do fast or you have trial fasted, that's why I keep emphasizing the point of trial fasting before Ramadan. So if you've trial fasted, for example, and you recognize your blood sugars are falling considerably, or that you're really struggling, you're feeling very weak, then you have personal experience. So this is another concept. You've got personal experience, okay? And that personal experience has to be what we call a dominant probability. You have clearly, a higher probability that you know that if I fast, that's going to happen again. So if you know, if I do fast, that's going to happen again, then in that particular situation, then you are excused from fasting, okay? So that's a decision you would make. You don't need a mufti to tell you that. Now, however, you need to take advice from a health professional, because health professionals, what they do is they look at all the sort of the trials, and they have a good understanding about the risk to you. So even though you're not feeling weak and you're not feeling tired, while you're fasting, and you've not had an experience like that, they will explain to you, look, there's a serious risk that you could become very unwell if you fast. So you have to listen to the medical advice, because they are informing you there's a greater than 50% chance that you will become very, like, for example, you can end up with ketoacidosis, which is a life-threatening condition if your blood sugars go really high, or you could end up with a hypoglycemia and fall unconscious if your blood sugars go really low. Now, if you're type 1, there's a greater risk of that. Okay, there's a greater risk of type 1 diabetics falling into those domains. That's why I would highly recommend that you need to talk to your medical professional, somebody who cares for your diabetes, and talk them specifically that if your fasting period is shorter, then there's a possibility. But type 1 diabetics, there's a greater risk in them. So usually they are exempt. Most type 1 diabetics are exempt from fasting. Whether you make that decision you want to fast, that's entirely up to you, but you need to take into consideration the risks to your health. Okay, so hopefully that answers your question. Inshallah.
Yes, Jazakumullah khair. Normally, that's what they say. They say it's a long-term risk, and you can't just have a dry fast because you're going to be dehydrated. So therefore,
there's other risks as well: ketoacidosis, thrombosis, clotting. There's various other risks. Yeah.
So does this make the hukm for me haram? Like, even if I try to do a few days?
No, it's not haram for you to fast. You're just not obligated to fast. You need to recognize the difference.